What is qualitative research? Qualitative research methods are used when little is known about a phenomenon, or when it is important to understand experiences or problems directly from the participants. Let's look at a case study using qualitative research. This study explored the problem of critically ill older adults pulling on or disrupting the technologies, tubes and lines, used in their care in the ICU. Although there were plenty of studies showing the prevalence and predictive factors for device disruption, there was no empirical evidence describing the patient experience or behaviors in nurses' response to the problem of device disruption. The researcher conducted a grounded theory study using observation, interviews, and longitudinal case analysis following 16 critically ill older adults throughout their stay in a medical ICU. The study showed that nurses assume primary responsibility for maintaining life-saving technological access and caring for critically ill patients. Patient behaviors indicative of technology disruption, such as reaching for or near tubes and scratching at insertion sites, occur in the context of their severe and terrifying inability to speak. These behaviors were interpreted differently depending on the nurse-patient relationship, facilitation of non-vocal communication, and patient awareness. These findings formed the basis for research to improve communication between nurses and patients in the ICU. This presentation will review a paradigm for qualitative inquiry, consider research questions for qualitative inquiry, discuss common qualitative approaches, and consider data collection, tools, and analysis techniques. The paradigm or worldview on which qualitative inquiry is based differs substantively from classic quantitative and experimental research. Qualitative research builds theory through careful, systematic description, concept identification and delineation, and by discovering how concepts interact. Qualitative theory-building research is descriptive, establishes relationships, identifies and delineates the characteristics of a phenomenon or process, explores variability in the phenomenon or process, and ultimately generates hypotheses. Quantitative research, on the other hand, tests relationships using probability and/or prediction, requires homogeneity, and seeks to minimize or explain variability. The qualitative view accepts and even seeks multiple perspectives or truths and values rather than discards extremes. The emphasis in qualitative research is on human interactions and experiences, and the analysis is interpretive, which means that the research team makes or extracts meanings from the data. Let's look at some exemplar qualitative research questions. Our first exemplar research question seeks to understand the experience of clinicians and office staff in implementing and using an electronic health record in a small community-based primary care practice. To explore experience, each research participant, preferably a range of roles and providers, would tell the story of implementing the electronic health record to planning, to training, transitioning, and use. Our second example asks for the perspectives or opinions of rural primary care clinicians about remote monitoring technologies like Apple Watches or digital glucometers. This is another research question seeking opinion and feedback from clinicians, specifically nurses, about a health information technology. Because the researcher seeks the nurses' perceptions and feedback about this new technology, the nurses' experiences as well as opinions of using the technology will be elicited. This question was posed by medical sociologists Barney Glaser and Anselm Strauss, and was addressed through several years of fieldwork, observation, and interviews on hospital units. The study culminated in a famous book, The Awareness of Dying, published in 1965. Glaser and Strauss codified the research methodology used in this study as grounded theory. Fieldwork, focused observation, clinical record review, and interview methods were used to answer this research question in a study to understand the care and communication processes when weaning patients from prolonged mechanical ventilation. There are many qualitative research methods and approaches. We will present the most common. This table provides a nice summary of the 6 common qualitative research approaches. The object of phenomenology is determining meaning of lived experience or philosophy. Of grounded theory, looking at basic psychosocial problems, processes, and social interactions. Ethnography looks at culture and function of a group, norms, and rituals. Qualitative description is a naturalistic description of phenomenon. Case study is an in-depth examination of single or multiple cases over time. And narrative inquiry, determining meaning and analysis of story or storytelling. Phenomenology focuses on individual perspective and experience. Grounded theory explores questions of human interaction and psychosocial processes. Qualitative longitudinal case studies are methods that provide description and explication of interactional processes over time. Ethnography focuses on cultural norms and social interactions in the context of group norms, customs, traditions, and roles. In healthcare research, group studied can be defined by a variety of affiliations, including ethnicity, work groups, sexual orientation, or organizations. Basic qualitative description is an approach of simple naturalistic description, in which the analysis is minimally interpretive, close to the data and words of the participants. Qualitative description is often used in qualitative content analysis and is useful in obtaining and analyzing participants' experience or feedback regarding an intervention. Narrative inquiry examines individual and common stories about an event or experience of interest. What about data collection and analysis techniques in qualitative research? Sampling in qualitative research does not favor randomization. Instead, participants are purposefully selected for variability on known characteristics such as sex, race, ethnicity, age, severity of illness, and etc. It is common to sample for maximum variability on particular characteristics or experiences thought to be important in understanding the phenomenon. For example, a researcher studying the experiences of mothers in talking with their daughters about reproductive health would want to interview mothers with active involvement in reproductive health discussion and those that report discomfort and less engagement in conversations about reproductive health. In most qualitative approaches, sampling occurs in tandem with data collection and analysis. In grounded theory, sampling is guided by the developing theory and what aspects of the theory require further data and explication. Sample size is not predetermined but is dependent on analytic saturation, or fullness of the descriptive themes or theory. Sample size can be estimated based on prior qualitative studies that have similar approach and scope, but the researcher must be open to adjustment in the final sample. There are a broad range of possible data sources and data types used in qualitative research. The data are usually text or words in the form of interview transcripts, field note observations, or documents. But qualitative data can also be numeric, such as physiological trend data. Data used in qualitative research can also be visual, such as photographs and video recordings. Other sources include print or social media, blogs, emails, letters, diaries, written narratives, or open-ended survey questions. A study may be strengthened by the use of more than one data source. In brief, data analysis involves labeling segments of text into descriptive codes. These codes are iteratively combined into more abstract or higher-level categories. Relationships between codes or categories are discovered through the process of constant comparison within and between participants and analytic segments. Qualitative analysis is best learned by apprenticing or collaborating with an experienced qualitative researcher. The first step in qualitative analysis is to read and reread the text to gain an understanding of perspective, story, and context. Then the coding and multiple levels of comparison begins. Researchers use memoing throughout this process to track their methodological decisions as well as preliminary analytic thoughts, connections, or relationships. The researcher is the instrument of analysis, and so self-awareness is particularly important to avoid bias or importing concepts that may not be evident in the data or words of the participants. Writing the story is a technique used to refine and extend the analysis, and eventually, after many iterations, to represent the findings. Qualitative research approaches vary in level of interpretation during analysis. Qualitative description is on one end of the continuum, and phenomenology, a highly interpretive approach, is on the other. Qualitative analysis is not a count of the number of codes. The product of qualitative analysis should not be a series of summative phrases or a list of codes, themes, or categories. Good qualitative analysis delineates the properties or dimensions of categories or themes and shows how they are connected. Common pitfalls in qualitative research include not using purposive or maximum variation sampling techniques, oversimplification, or thin analysis. A thin analysis may appear as restating the obvious or ignoring context. Other pitfalls include importing existing theory or concepts onto the data. This can be avoided by using the last stage of analysis or discussion to compare findings to existing literature or theories. When reviewing publications of qualitative research, the following guidelines were developed by Cooper, Lingard, and Levinson and may help determine qualitative research quality. Number 1. Was the sample appropriate to the research question? Variability, selection, saturation? Number 2. Were the data collected appropriately? Perspective, reflexivity? Number 3. Were the data analyzed appropriately? Thick description, data close or interpretive, confirmation? 4. Can I transfer the results to my own setting? 5. Do the researchers identify potential ethical issues? And 6. Overall, is the research process clear? The best practice for planning, implementing, analyzing, and reporting qualitative research is to consult a qualitative researcher. The following resource list provides published examples of qualitative research.